So today we will be talking with Emilu Siundjukovu from Latvia and Svenu Parkelu from Estonia, two people that are heavily involved in medical tech startup and ecosystem. So we will look at, what does it take to take an interesting, valuable app which is already registered, for example, in Estonia, and how to make it available for people in Latvia. We had a discussion with director of Roche for Latvia, and that he was mentioning I think, a very important example, which I also see in our life all the time, but I didn't see this particular example. So he was talking about data lakes,
right? And
then the fact that data lakes, they are hugely important in medicine today, right? Because data lakes, allows you to see the person from birth to death, and then you can see what are the outcomes depending on treatment, right? For our listeners. But then he's saying it doesn't make sense to have data lake, for one country if it's a small country. From what I understand, Estonian data lake is connected to the Finnish data lake. But then if we look on us as Baltics or us as, northern countries, so how do you see, how far are we from that type of thinking that these types of, examples or these types of strategies and tactics, they kind of become natural for us?
Right. So first, perhaps I would even start a little bit bigger and bring in the initiative of European Health Common Data Space and use this kind of as an example of how things might be happening in the near future. And many of us perhaps know that the European Common Health Data Space is an initiative that's been there for a while. It's very interesting for the companies, for other stakeholders as well. The question is, how do we set it up? So, and there are two ways, technically, perhaps there are many ways, but there are two ways at least how this can be done. One of those is that there's a huge data lake that sort of gathers the data from different EU countries. Or the other one is a system similar to what we use in Estonia and what we call the X-Road, and which is the secure information exchange layer between different small data lakes. So technically, in Estonia, you can take your ID card, and you can access several public sector services, which all have their own data servers somewhere. And the data is not gathered and kept in one place, but it's kept in many places at the same time. And you can just access this with a card. So, and that's sort of one of the questions when we look at Europe and when we also look at the politics. So how should we set it up from the infrastructure view? So should it be like a physical space, or should it be some kind of information exchange infrastructure?
So it sounds like a sovereign cloud, right?
Yeah, or like federative approach is an example. But I think you touch based on two topics. One is European Health Data Space, and everyone is talking about this, like hospitals, also NHS, both in Estonia and Latvia, Ministry of Health. But the thing is that we should not talk about this, from a perspective like very similar to GDPR, everyone was afraid of. They were waiting for this, date to come, and they were thinking about something, like as a punishment or a framework to limit the stuff. It's not about limiting; it's about enabling. And as you outlined, the technical architecture and approaches are already on the market. So we can look at this, as a centralization or ingestion of data, or federative approach, both for AI and machine learning, or data storage and data access. The thing is about, outlining the direct value, both clinical-wise. So like as an example in Latvia, we have cases when, within the population happens only once or twice. Why don't we, compare and talk with Estonian colleagues, Lithuanian colleagues, or Finnish colleagues, because your guys are very interconnected within two countries, to help to treat in a more personalized or more, effective manner. The same thing as industrial-wise. So the pharma, medtech, and AI companies come in here, they're stating, you're doing the good stuff, guys, but you're very small. So if we, it's 3 hours ride with a car, so Sven, you know about that. So why don't we just, erase the borders data-wise and just open this up? But I don't think it's a technical thing. It's rather both, for sure, policy making, but also rather than, enabling the specialists to understand the value first, not limitation first, coming from the policies like EHDS or something.
Are we anywhere close to this, or is it just dreaming?
I think we're, now we're closed only, exact use cases wise. Like we have research initiatives between Tartu Biobank, doing a great job actually, both engaging population. So you guys, you can go to the drugstore in Estonia and purchase with a DNS test or a DNA test, sorry, and or participate in a clinical research study, which is cool. We don't have this, layer of population engagement yet. Nevertheless, we have initiatives like Children's University Hospital collaborating with the Finnish Helsinki University Hospital, Estonians as well. But it happens, like only on direct use cases, not umbrella-wise. We're not still there. And you just mentioned me about the topic about the digital therapeutics and the need of Estonians as well to look this not from Estonian perspective, Baltic perspective. So maybe Son, you can tackle this.
More, yeah.
Right. So there are several aspects here. So of course, you mentioned the rare diseases and many cases where data would unlock opportunities that are currently not available for those patients. So I really like this statement that a rare disease may not seem very important to many people, but if you have it, it's the most important disease for you. So it's really a question of perspective and this kind of the option to access and exchange data over borders is something that would unlock many options and help patients to receive better treatment in cases where there is currently no treatment available, but also in cases when there are, and this kind of cross-border exchange could enhance it in many ways. When we're talking about setting up the European health data space, we're in a way talking about also about the cross-border use of secondary data, or secondary data use cross-border in cross-border dimension. And that's not really common in Europe. So we've been keeping our eye out for these kind of cases, and I must say there are very few cases where this kind of data is used cross-border, but it in a way shows that there's a clear interest, and it's been done in research projects, exactly as Emil said. So this is quite common that in case of research projects, some kind of data sets are made available for a wider set of participants. But technically it also shows that there's a lot of interest for that. And the question, especially for smaller countries like the Baltic countries, is exactly how do we make it happen as soon as possible? Because let's say in Germany, in France, in Spain, let's say this kind of cross-border data exchange is not that important because they have a lot of people. Many things that require large sample sizes can be done there in a much easier way. So that's why we, as smaller countries, have to collaborate on a different level.
But I think one of the parts is not only once again technical or European policy making wise, also narrative wise. So you Estonians doing a great job on this, e-Estonia and pitching this across the whole globe on the conferences or meetups and other events. The same is Finland now doing with the real-world data. So basically what they say, they have registry from 1950s or oncology registry, population registry, etc. They pack this in one landing page in slide deck with the exact people working full-time on this topic. And now they went to Boston, to Israel, to Basel, to Switzerland, and pitching the stuff. Hey, if you're an industrial academic player, you have a landing page, you can click apply and work with us and utilize data for your own novel therapeutics or vaccines or whatever it is you're developing, and monetize as well the stuff happening in Finland to bring more value to Finns afterwards. And that's something that we also should be focusing on, to have a unified narrative, putting us as a service or a company.
But where is the ball right now? Because just to make it real to our listeners, if we talk child cancer, the center that we established in Latvia, we have, as far as I understand, maybe 50 cases a year. And then if we want to provide quality care, life-saving care to these kids, it is most probably virtually impossible to do it just from Latvia. So we need to connect doctors who are specialists in this particular cancer, wherever those doctors are. This can be Switzerland, this can be France, right? So I think, the economics, the science kind of precludes creation of those, of a center like this in a small country. So we have to go outside. So where is the ball right now? So who is interested in actually getting to this? Because then the other alternative is to, drive, to Germany.
I think, you know, for sure, healthcare professionals are the ones interested as well. Like speaking of a pediatric oncology and true university hospitals, these guys would like, you know, to help for sure both patients, their parents, as well as to treat this in a more efficient and personalized manner. But I think one of the challenges is, once again, you know, technological wise, to share and open data, we can do this already. So it's not a big problem. I think it's more of a, you know, perception and policy wise. Because even if we say that we need to open pediatric oncology data for University of Latvia, Riga Technical University, the one located in Latvia, it's like a blocker in the minds already. You know, it's very hard to understand, oh, you know, if I do something incorrect, I will be punished. And, you know, they don't understand the exact process, 1, 2, 3, 4, how to do this. And if we speak about, you know, Germany, Switzerland, Finland, or wherever it is, I think, you know, even if we cannot solve this within one country, it's quite hard, you know, to do this in a robust manner through cross-border collaboration.
I mean, I see it with a lot of our clients, right? You know, you really need to have the economies of scale to be able to do anything that has global demand. And maybe kind of switching topics a bit, you know, we joined European Union roughly at the same time. You know, we've received a lot of funds from the European Union, so they've invested quite a lot in the Baltic economies, right? You know, what I learned recently is that Czech Republics, they're going to become the first Eastern European nation to start to become a contributor of European funds, right? Or they will soon become a contributor. Maybe there were others, right? So, like, if we turn the narrative, if we turn the tables, right? So we received a lot, right? But now it's like 30 years. So what do we give back? When do we give back? So how do we make sure that the startups that we create, the technologies that we create, they matter not only for rebuilding our nations, which we were all focused on, right? But also that we matter, at least in the nearest geography, in the Nordics, Northern Europe in general.
So I think we're already doing that. So even though we are still countries who are perhaps getting quite a bit, and this is actually true, that we do get a lot of from Europe, and the question is, how do we use these funds to set up something that is sustainable and provides value for European healthcare and also on the innovation ecosystem? Now, what we also have to keep in mind is that healthcare is something that is quite highly regulated, and where making a change takes a lot of time compared to all other sectors. So this is pretty much the most highly regulated economic sector is healthcare. So what it means is that even though when we're moving at the right direction, we have to keep in mind things like do no harm principle, which is very clear principle for all the medical doctors. So they have to make sure that whatever they are doing with the patient is not to harm it. Then we have the GDPR. We have to make sure that all the data that goes from one place to another is kept in the right way, is kept securely. So all those regulations, all those layers of complexity make it just a little bit harder for the innovation to get from lab to the bench side, so to the bedside, to help the patient actually. So it takes a lot of time. Those processes are, I mean, they're not set in stone, but they are very difficult to change because many people have to agree that those very basic principles are met when we bring in an innovation to a hospital, to the patients. And that's why this kind of taking the innovation to society takes a little bit of more time than in many other economic sectors.
I think another part is, you know, both within inhaling innovations within Baltics as well as cultivating innovations is, once again, the perception of healthcare as such, because we perceive healthcare in its correct way as a social thing. So there is a great social cost why we do healthcare, why we invest in healthcare, to live longer, you know, more higher quality lives for both our children and ourselves. But it's very hard to put this, you know, return on investment, not health econometrics wise, but rather than, you know, that medtech and pharma can come to Baltics and, you know, train their AI models on top of the data to provide novel therapeutics or novel diagnostics models. It's quite hard to pitch it in that manner. And this is what Finns are doing now with this real-world evidence, Fingenius, I think it's called Fingenius, strategy. So they have a company who does it, But once again, putting in the first place that the social cause to bring, you know, all of the ROI to the citizens of Finland is the main topic. It's not, you know, creating, I don't know, kind of, you know, just a company or a private public partnership and just go straight away. So I think that's an important thing that we need to put this perception-wise. So it's not only social cause, but we can generate social cause based on the ROI developed.
But if we kind of mention some examples, so what would be examples of, you know, important companies which are Baltic companies, startup or existing companies, which matter across Europe? So what are, you know, 5-10 startups, you know, you could mention?
Well, we know one, of course.
Yeah, we know one, yes.
Yeah, so we work from here.
What do you do, yeah?
So we accelerate clinical research processes. So we have data discovery tools as well as patient engagement tools. With this dynamic consent, so we can engage people, population, patient, disease-specific patients in clinical trials faster, more efficient, more private way. So we work in Latvia quite extensively, but we have projects in the UAE, in Czech Republic, and Italy, in 14 countries worldwide. And the thing is, in Estonia, you have guys, the first startups that did the certification, like Migravention for migraine management. We have Vigo Health, which is the first digital reimbursed app. So you can basically, the doctor can prescribe you an app in Latvia. How cool is that? But I think one of the things that we need to also like demolish or raise is that you have great stuff happening in Estonia, like this migraine management app as an example, which is validated and used in Estonia. But these guys cannot understand in a transparent manner how to extrapolate this to Latvia. Like, you know.
Okay. Maybe we can talk about that. So what's the problem there? Because it's probably possible and easy to agree with the Apple iStore to get it there and then everybody can solve. So what's the problem? Maybe you can help me to understand.
So one of the issues here is that I mentioned the levels like do no harm and GDPR and all those, let's say, hygiene factors. And then on top of that, you have what I think Emil also mentioned is the business side and the economic factor. So if we're talking about healthcare financier, like in Estonia, the Estonian Health Insurance Fund. So if they want to introduce a new treatment over an old treatment, they have to make sure that it's also valuable for the patient, for the hospitals, or for the country, for the healthcare system from the economic perspective. So how are you going to make sure that this health app is actually saving you money, for example? So how do you figure that out? And in this sense, I'd say Health Insurance Fund in Estonia, they have created very interesting initiative where they've selected a number of startups. They've invited them to collaborate with the Health Insurance Fund. They will pay them some funds as well to develop jointly these kind of financial models so that the Health Insurance Fund and the startups both understand what factors are relevant. So how are we going to figure out where's the value? So how are we going to show that value to patients, to hospitals, but also for the healthcare system? So what are the economic factors? So is it so if we're talking about the migration example, is it reduced number of headaches, or what are the terms how we can show that this actually is good for patients?
But that process happened in Estonia, right? So this is a registered, you know, app. The regulators have approved it, right?
So they've done the class 1.
So stage 1, right?
Yeah, stage 1.
Okay, yeah. Okay. But then as far as I understand, like getting this app from Estonia to Latvia is more difficult than getting class 1.
I think in some points it's less transparent and a little bit more foggy because, you know, this is something I think Sven is also talking with the Estonian Health Fund. And this is the job that Children's Hospital actually now start to do. They would like to have, you know, like basically speaking very, you know, simple terms, landing page. So the startup can see, okay, step 1, I have a champion in the hospital, like Mr. John Apple, see if I can contact. Step 2, I send the pitch deck, 5 slides, A, B, C, D, E. Step 3, I send the budget. Step 4, I do this, I do that, you know, and then it's understandable. Because like EIT Health as an example, the European Institute of Technology, they partnered with Children's Hospital, like around 12 startups, went to, you know, to pilot and discuss some stuff. The most asked question was, hey, what do we need to pack? What are the documents we need to pack together to put this to local NHS? Because they would like to scale up. It's, you know, it's quite understandable.
Obvious,
yeah, sure. And we cannot answer this question, you know, like within one email. And that's, I think, one of the problems.
And then from that perspective, what was the change here locally in the region because of COVID? Because we can read about FDA process being changed to accommodate faster vaccine approvals and, you know, test approvals. Did our regulators change, you know, over the last 2 years?
I'm not sure that the regulations changed that much because of COVID. I think the processes that were there are still there. Regardless of COVID, of course, the COVID brought attention to digital tools very sort of sharply to our attention, and we realized that we have to use more digital tools, and also were forced to figure out what we can do and how we can use those tools in a safe and meaningful way. So in a way, this was a very, very strong push for innovation as well. But from the regulative point of view, I don't think many things changed. It was more about acceptance of those digital tools in daily practices.
But then the speed of the process still is much higher now than it was, right? So the process didn't change. The way you do the process has changed, and then the speed is better, or it didn't.
I'm not sure if the speed has actually changed.
I think the head of Estonian Health Fund was here in American Chamber of Commerce visit, and he was talking about telemedicine and the video consultations. So before COVID, he was trying to pitch this to hospitals, and everyone like, come on, what is this stuff? 2020 came, everyone was asking about telehealth, and they needed to put it today. It's not like after half a year. So people start using like Zoom, like tons of different solutions. So it was oversaturated. Now they're once again back to the same thing. So the adoptance of telehealth is not 100%. So they still are coming to the GP, and GP is typing stuff on the keyboard, just look at you and says, hey, your e-prescription is in the e-health system. Go to the drugstore. And that's the only thing when you come to the GP in most of the cases. The thing is, what we didn't use, as well as in Latvia, was the same thing. So, the market was asking for solutions very fastly. But the thing that we didn't do, and we still need to do, is to summarize all of this experience within 2 years of like telehealth, as an example, and put this on table. So what worked, what didn't work, and maybe create some kind of a certification regulation pipeline for telehealth solutions.
Because if we compare this with education, one regulatory problem that they faced was that a lecture delivered over Zoom didn't count as lecture. So you could do it during this special period, but in general, that's not a lecture, right? And then, is this telehealth process, is it defined well enough? What is, a digital consultation? What is not digital consultation? Or is it?
We're doing this in Latvia now.
Okay.
So I know that the Ministry of Health has developed this Digital Health Council. And actually, in January, we'll be having a first session about the telehealth as such, because there is both, regulatory-wise, so what is telehealth, how to put this in some kind of, taxation, so we can pay, NHS can pay for the same contact hours, but also from respect of having a code of conduct, both for healthcare institutions, for developers as well. Because if you come to the hospital and they say, yeah, I just need to see the patient, they don't understand, the data privacy, what type of data we should put to NHS or CDC or Ministry of Health, etc., etc. To put this as a multi-pager document, to have it in front. Because hospitals also, they know that you can get punished for, data privacy issues, etc. But we need to have, the code of conduct as an enabler, so that I can understand, oh, if I'm using this solution, I'm good. If I'm using, just passing photos on the WhatsApp with lab results, it's not okay, maybe. So that's the thing we should
probably
work
not,
on.
Yes,
yeah.
Probably not.
But I don't know what is it in Estonia. I think,
So digital consultations are allowed in Estonia, but you have to register yourself as a healthcare provider, which means that you still have to have a physical space with a sink, with a tap, and there are still some conditions that apply to all healthcare providers. And if you are offering digital service, you don't get an exclusion from that. You still have to meet those requirements as well. So.
Which is a good stuff, actually. We have the first online clinic in Latvia now. So Medon is they registered as a hospital license, but it's fully online, virtual. So around 40 practitioners are there. So I'm not sure how many people are using it still, but I think it's a good start.
But it's a good start, right?
It's a very good start.
It's a very good start. Yeah. And then maybe kind of looking back a little bit, I think like 7-10 years ago, it was an important topic for all startups. What is the legislation? What is the legislative field? What are the conditions for startup? And then like last 3 years, I have a feeling that this was more or less fixed. Most of the things are done. Is there like anything that you still expect, the governments to do, or, is, You're now on your own. I see the smiles.
That was actually, yeah, I'm wishing it was so easy, and, but technically there are constantly new regulations that are coming out. Somewhat they perhaps may be fixed to some time, but it's not specifically perhaps because the framework is ready. There will be always new things that can be agreed upon and fixed. The question is that the new set of rules that were set by EU has created a lot of work for notified bodies. So how this works is that if you have a medical device, there's a specific bureau, specific organization that has to give you the accreditation. They're called notified bodies. And there's
for every instance of the device or the kind of type of a device?
So for every device, every device,
physical box.
Physical and also digital device, if you are a medical device, and if you do significant changes, so I'm not going to go into that, but if you change your, let's say, medical device so that it becomes from version 1.0 to 2.0, you have to go through that process again. And there's a set of rules what you can do without going through that process and what you cannot do without going through that process. So notified bodies are currently, they have a lot of work now, and that's why the new set of medical device rules were set to come to force next year. But this deadline was postponed to 2027, because those notified bodies have so much work ahead of them. It was clear that the companies who want to meet the new regulatory terms just cannot. It's not physically possible for them to do so. So there are these kind of barriers still in the market, and but I'm sure that these regulatory processes are being constantly developed. So.
You seem to have enough regulation, right?
So for now, yes, but perhaps new things have to emerge.
Yeah, I think we're in the head of startup. I think both local or Latvian wise, we have some homework to do for sure. Because now working also with major hospitals, it means that you cannot scale this up. Even it's a small country and a small market of Latvia, because you go from hospital to hospital, they all have their own privacy things related, data structure things, and etc. We don't have any unified, as a code of conduct or guidelines, whatever you call it. So we can just have it and then tell, okay, now we're ready to work with any institution in Latvia. And this is, I think, would be quite of a good advertisement thing for startups coming to Latvia.
It gives you scale. Yes,
for sure, because it's not enough for you to go to one hospital. You will not have any huge ROI market-wise. Speaking of pan-Baltic-wise, I still dream, and this is also a startup, which we should do the homework as startups, community-wise, to have this, transparent understanding of, how to, get to the car and within 3 hours ride, bring a solution, and then you understand the rules of the game. Because now it's, it's a black box, both Lithuanian-wise or Estonian-wise, and this is something that, we ask Estonians to help us out and vice versa. This is something we should put, also policy-making-wise, maybe, create some kind of a unified framework will be a lot, I think, but still, yeah, maybe.
It's a good dream to have.
Yeah, because currently how it works is that each country, or all the European countries, they have the regulations that come on the EU level. Then you have specific, perhaps to some extent regulations, but also the financial models and all that you have in your nation. And then what the companies still have to do, let's say that you meet all the EU regulations, then you comply with whatever is in Estonia, for example. You figure out with a health insurance fund how they going to fund your application. And then if you have the app, you still have to go to the doctors and convince them that your app is actually doing a great job. So there are so many different levels to get this health innovation to the market.
To the person.
To the person, exactly.
Yeah.
Yes.
That takes a bit of time.
Yeah. Thank you for coming over and then bringing those Baltics and especially Estonian perspective. It was a much longer way for you than for us. Special. Thank you.
It's a great pleasure.
Yes, and then let's work together to make sure that those people get those treatments earlier rather than later, especially if the reason was bureaucracy.
Yeah. Thank you.
Thank you.
Thank you, Max.
Thank you.
Thank you.